Hello everyone. Today we are going to discuss nasal decongestions. It comes under 6th semester pharmacology for UG pharmacy in GTU, Gujarat Technological University, and myself Dinesh Dangar. These are the alpha and agonist which on topical applications is dilute solution in 0.05 to 0.1%, produces vasoconstriction in the nasal mucosa which primarily expresses a receptor. So these are the agents which are generally used for the nasal decongestion where person may have a difficulty in breathing and generally used in cases of children's. The imidazoline compounds like nafazoline, xylometazoline and oxymetazoline are relatively selective alpha agonists. They are basically adrenergic agonists. In that specific, they used to act on alpha receptor. They have a longer duration of action, that is 12 hours, than ephedrine. After congestion in nasal mucosa, it is claimed to be less than that of ephedrine or phenylephrine. They may cause initial stinging sensation, especially stinging sensation can be seen with nafazoline. Regular use of these agents for long periods should be avoided because mucosal ciliary function may be impaired and the dryness of skin inside the nose cavity can be seen. These drugs can be absorbed from the nose and produces systemic effects, mainly central nervous system depression and rise in blood pressure can be observed. Nasal decongestions should be used cautiously in hypertensives and in those receiving monoamino oxidase inhibitors. Nasal decongestions. Two main types are used into that is adrenergics and the corticosteroids. Adrenergics, that is what is the largest group into it and which constricts the dilated blood vessels really leading to reduce in release of secretions in nasal mucosa, whereas corticosteroid may reduces the inflammation. While going to classification, adrenergics like ephedrine, the brand name that is Vicks, next is nafazoline that is Previne, oxymetazoline that is Afrin, and phenylephrine that is Neosporin. Intranasal steroids that can be used as nasal decongestions are peclomethasone dipropionate that is Biconase and the vancenase, whereas flunisolide that is Nasalide. Goal of the nasal decongestions. The major goal that is to reduce the congestion in nose and to establish the normal respiratory pattern. Generally, two dosage forms are used, oral and the topical. And in the cases of topical, nasal spray are used. As you can see here, Otrivin is a kind of nasal decongestion. Oral decongestions. In that case, they may have a prolonged effects. They are less potent. No rebound congestion can be observed, and they are exclusively adrenergics. Here we can see the example like Sudafed and the Sudafedrine. They are available in forms of tablets. Phenylephrine. It is a selective alpha 1 agonist with negligible beta action. It raises blood pressure by causing vasoconstriction, and that vasoconstriction may lead to the complete cessation of flow inside the nose. Because it has little cardiac action, reflex bradycardia is prominent. Topically, it is used as a nasal decongestion and in the eye for producing mydriasis. But the major role is to nasal decongestion only. Because it is orally active with longer duration of action, that is 4 to 6 hours, it is also a constituent of orally administered nasal decongestion preparations. Topical decongestions, that is adrenergics, like they may have a prompt onset of action and sustained use may lead to the rebound congestion, right? While going with the longer term administration may cause this rebound congestion. Both adrenergics and steroid are potent and they work well in the conditions of nasal decongestion. Beclomethasone. Beclomethasone is a other choice after adrenergics. Into that, beclomethasone dipropionate is a second generation synthetic corticosteroid agent and which is structurally similar to the dexamethasone. And beclomethasone will be provided in the cases where inflammation can be persist. It is a prodrug of an active metabolite, that is beclomethasone 17 monopropionate, which acts on the glucocorticoid receptor to mediate its therapeutic action. Beclomethasone dipropionate itself possesses weak glucocorticoid receptor binding affinity, and again it is rapidly converted into the 17 beclomethasone monopropionate upon administration. Formulations for oral inhalation, intranasal and topical use are available for beclomethasone dipropionate. Due to it has or its anti-inflammatory, antipruritic and anti-allergy properties, beclomethasone dipropionate is used in various inflammatory conditions such as asthma, allergic rhinitis and dermatosis to reduce symptoms. Generally, beclomethasone will be given in a condition where nasal decongestion might be because of inflammation. So, in such cases only beclomethasone will be provided. Nasal steroids, they are basically anti-inflammatory in nature. They decreases the inflammation inside the nostrils as well as the nasal cavity, whereas second, it may reduce the nasal congestion. Side effects. While coming to the side effects of dipropionate as well as adrenergics, they may produce nervousness, insomnia, palpitations and tremors. But these four can be observed with longer term administration, while steroid may cause local mucosal dryness and the irritation. Uses of nasal decongestions, they can be used with acute or chronic rhinitis, during common cold, and in cases of common cold generally tablets can be preferred. In cases of sinusitis, hay fever as well as in certain cases of other allergies, they are prescribed. Nasal decongestions. What nursing implications can be considered while using nasal decongestions? Avoid decongestions in the following clients, like with heart disease, because as we know that they are the potent agonist of alpha receptor, may leading to hypertensive crisis and increase in blood pressure. So it is avoided in the patients of heart disease, that is hypertensive diseases, as well as in certain cases of respiratory diseases where already there will be a elevated bronchial constriction. So in these two conditions it should be associated, and in cases of drug allergy priorly it should be assessed. So what we have discussed today, that is all about those adrenergics and beclomethasone in cases of nasal decongestions. Thank you.